Welcome back to Detroit's Morning Answer with John Anthony. I had some audio to play, but I don't want to play it because I want to delve right into this conversation. Today, I'm joined by Tony Lyons. He's the director of MAHA Action. It's a national movement fighting to reverse America's chronic disease epidemic and force long overdue reform in public health. He also serves as president of Skyhorse Publishing, a company known for publishing the voices that challenge comfortable lies. I love that term. And expose what legacy media refuses to touch. We are discussing the MAHA's reports piece, Blue States rebelling against Kennedy and the CDC are gambling with lives. It is more than a headline, folks. It is a warning. Across the country, states that once claimed to follow science, remember that, are now defying it. Not because of evidence, but because of ego. The rebellion may be cloaked in politics, but beneath it lies something deeper. A collapse in trust, a reckoning with authority, and a fight over who gets to define truth in a nation where health has become a battlefield. Tony Lyons, welcome to Detroit's Morning Answer.
Yeah, thanks so much. Great to be on.
I'm glad to have you. Tony, now this article argues that blue states rebelling against Kennedy and the CDC are gambling with lives. What do you see as the true stakes here? Is it going to be a political showdown, a scientific correction, or just simply a moral failure?
It is definitely a moral failure. We've had, government that's colluded with big pharma, big food, big ag for the last 20 or 30 years. And now we have a group of powerful people in Washington who are not trying to make more money. They're not trying to get more famous. They're there to protect the American public. And there are millions of Americans who are not hearing that story. And they're not hearing it because the media is lying to them and because government officials at the state level and also at the federal level are clinging to this kind of corruption at the expense of public health.
Tony, we've reached a point, in my opinion, where governors and these agencies, they're no longer debating data, but they're weaponizing it. How do we get here? When did science stop being about discovery and start becoming a tool for control?
I was looking at a sign in somebody's window a couple of days ago, and it had 4 or 5 different statements, and 4 of them were things that everybody would agree on, and then one of them was science is real. And I was thinking about that statement, and I was thinking, so much of science has been totally corrupted, that it's been co-opted by the companies, it's done by the companies, it's funded by the companies, and meant to protect those companies. So it isn't real science. And we don't have real science in this country. And we need an administration that will give us radical transparency, because we can't understand what's good for us, what's healthy, or what's going to poison us if we have science that is made for us and delivered to us by the companies that profit from the outcome of that science.
Yeah, Tony, now, one of the things I do know about you is that you've been warning for years that health policy, that it became captured by these corporate interests. Does this rebellion prove that politics, not public health, is now the ruling authority in America?
It definitely does, because, for years they've been saying, trust the science, trust the experts, trust the CDC. But those organizations, those branches, those media sources, those scientists, they've all been corrupted in the past. And now when you're trying to wipe out that corruption and trying to deliver real science to the people, then they say, don't trust the experts, don't trust the CDC, don't trust the president, don't trust anybody other than the companies that are going to profit from it and the politicians who are taking money from those companies. So I think that it's becoming more and more clear how the system works. And I think millions of Americans are seeing what's happening and they're rebelling against it. So the blue states are trying to rebel, but they're rebelling as an act of frustration that their corruption is no longer going to work.
This is insane. One of the things this article does is it highlights data suggesting that certain vaccines were neither as safe nor as effective as first claimed. Now, you studied the politics of science closely. What does it say about a nation when the truth has to fight for its own oxygen?
it's a really scary thing, that you have the New York Times saying pesticides are actually safer than we thought. Toxic food dyes are actually safer than we thought. Vaccines are always safe, regardless of what you put in them, and you're not allowed to think about it. All of these kinds of things have to be jarring to the intellect of any serious person. When you think about that, you can't have whole classes of products that are automatically safe even before they've been researched. So, I think this is changing, and I think that it's going to be painful, and that these states, these blue states who are, sort of going their own way, and they claim, well, they're following the science, and everybody who disagrees with them is anti-science. So it is really a cultural battle. It's a battle for the hearts and minds of millions of Americans who believe that they're following science, but they don't understand that science is not real anymore, that we need to get back to a kind of science where you can question anything, where you can look at the nuance, and then you can begin to exercise your freedom.
But, Tony, we were just told that when we were arguing against the COVID vaccines, the COVID mandates, the COVID lockdowns, that we were conspiratorial. But now that President Trump is in office and these blue states are saying now they can't trust the CDC. Now you can't trust the science. I mean, Tony, how is somebody like myself, because I actually lost my YouTube channel because I challenged the COVID vaccines and the entirety of the decisions that a lot of mayors and governors and the president was making, and specifically J.B. Pritzker, because they talk about no kings. I mean, they were sending proclamations like they were just free. How are we supposed to recover from that? How are we, the people, because I know a lot of parents feel betrayed because we were told to trust the process that concealed risks and things of that nature with these vaccines. How can we recover from this, Tony?
I think the main thing is for people to be educated, for people to recognize what's happened to them. There's a great book that we're publishing. It's called Forbidden Facts by Gavin DeBecker. And, in this book, you learn about the lies that have gone on for decades and that they culminated in the COVID vaccine. And it's a book about government deceit, about fake science, about how there's a government agency, it's an NGO, but it's been funded by government agencies. And it is a crisis protection organization called the Institute of Medicine. And over about 40 years, they researched things like Agent Orange, Johnson & Johnson's baby powder, Gulf War syndrome, all of those kinds of things. And they found that every one of them was not a problem to public health. So they actually said time after time, Agent Orange did not create birth defects, was perfectly fine to take, could be exposed to. And then they were given the task of finding whether the childhood vaccine schedule was safe, effective, whether it caused autism, whether it caused any other harm to the public. And they determined that that there was no danger. But they were the same people who had looked at Agent Orange and had said, no problem here either. So they've been lying to us in all kinds of ways. And until we understand that, we can't make rational decisions. And that's not being anti-vaccine or anti-food or anti-pesticide. It's about we want good information so we can make good decisions for our families, for ourselves, for our children.
Well, Tony, federalism, when I think about how and why it was designed to protect liberty. Yet, for me, it feels like it's now tearing the country apart. Should states have the right to defy the CDC, or is this rebellion from the blue state proof that our system has collapsed under the weight of mistrust?
It's collapsing, but I think that it shows people that they should think about it, because when they see real disagreement, even though I think these blue states that are doing it are doing an incredible disservice to the population of that state, to all the people, all the families, all the children. But I think it is good to have disagreement and to have real debate so that people say, everybody doesn't agree about all these things.
Oh, I'm sorry. I was agreeing with you. Yes.
Yeah. So that it allows people to say, wait a second, maybe all the experts don't agree on anything. And maybe that's what science is. Maybe science is that ability to disagree, that ability to think it through for yourself. You know your own body better than anybody else does. And the second person is, your parents or your doctor or the people who are close to you, not the government, not the one-size-fits-all corporations who are giving somebody who weighs 300 pounds the same dose of a medical product that they give to somebody who weighs 100 pounds. That's not a good system. And you should be allowed to choose for yourself, and you should, then be able to have access to the information that makes it possible for you to make good decisions for yourself. That's where I hope all of this goes.
Tony, the media narrative has shifted too. When I remember this clear as day, when red states and red governors questioned mandates, they were labeled reckless. But now blue states are doing it. They're being called courageous. What does that hypocrisy tell us about the moral corruption of our information culture?
Yeah, it shows us that it's just been taken over, and that these media sources, these government officials, the government agencies, they're all kind of working together, and they have been for a very long time, to lie to the American public at the expense of the American public to make money for themselves. And I think that if there's one great thing that came out of COVID, is that there were so many things that didn't make sense. So many millions of people recognized that they were being lied to. Many didn't, but people said, hey, didn't you say that if I got vaccinated, I couldn't get COVID? Didn't you say that I couldn't transmit COVID? So they knew then that those things weren't true. They knew that they had been lied to, from the president all the way down, to so many different people on television, people at the New York Times, everybody lying to them. And that made them think, well, maybe I have to have a different way of taking in information, of finding information, of analyzing information. And that, I think, is leading to massive change. And then these blue states are kind of fighting that change, and clinging to this sort of one-size-fits-all medicine, this myopic view of what the truth is, that science is either true or it's false. Science is a process, and anyone who really thinks about it knows you're supposed to think about it. You're supposed to disagree.
Oh, I love it. If you're just joining the show, we're talking to Tony Lyons. He's the director of MAHA Action. Now, let's zoom out a little bit, Tony. America, we spend trillions on health, but chronic diseases keeps climbing. Are we ignoring prevention because illness is more profitable than wellness?
Definitely. I mean, we need a government that incentivizes people to be healthy, to take a walk, to look at food labels, to go to the gym, to really do things, to get a lot of sunlight. Not have this mentality that there's a drug for every problem. People who are fat, 9 times out of 10, they're eating too much and they're not exercising enough. That's not a drug problem. That is a cultural problem that we can fix. And, we've been driven into this unhealthy life because so many people are preying on us, trying to make money on us. And now, one of the things that the government is trying to do, something we should all be proud of, whether we're in a red state or a blue state, is the presidential fitness test, is that so many people will look back on their own lives. And when they were in high school, they were proud that they could climb an 18-foot rope, that they could do 20 pull-ups, that they could do push-ups and sit-ups, that they could jog. What percentage of kids now can do any of those things?
None.
It's a really low number.
I remember doing that. I remember climbing the rope when I was in grade school. We had that whole fitness test that we had to do, and you had to pass. I passed it on every single time that we did it, but I hated it. I'm not going to lie, but I do believe we need to bring that back. But, Tony, what does MAHA Action see as the first step toward reclaiming health from the corporate and bureaucratic capture? Is it legislation, education, or just simply a moral awakening?
It's a combination of all of those things. One of the things is that we have a weekly media hub every Wednesday at 4:00 where you can kind of tune in and you can hear, government officials, you can hear health experts, you can hear influencers talk about things that are just not covered in the media. Yeah. So this week, yesterday, we had Dr. Oz come on, and he talked about what the government's actually doing. And he talked about all the nuances of it. And it's hard to listen to him and these other people and not say, this is an incredible breakthrough. These are serious people fighting for us, fighting to actually reclaim our health. Like you said, we spend more money than any other country in the planet on healthcare. We're the richest, most powerful country on earth. Why do we have the worst health outcomes? And that's because people have lied to us. And it's nobody's fault, but, we can reverse it now. We can reclaim our health. We can reclaim our freedom and make better choices.
Now, over at Skyhorse Publishing, where you're the president, now you've published authors who've exposed these uncomfortable realities about Big Pharma, censorship, and even the pandemic response. Now, Tony, how has that experience shaped your understanding of what real transparency looks like in what I call the era of suppression?
Some of it started for me years ago when I published a book about GMOs. And, it was a compilation written by a whole bunch of very old professors, really serious guys. And we met at this, at a museum in New York. And, this might be not safe. Having a GMO salmon might not be a good idea. Let's slow down a bit. And they got attacked from all sides. This is maybe 20 years ago. And I was just shocked by it. These were tenured professors from the best universities. And they were saying, all universities are being overrun by these big corporations. They're controlling the administration of the universities so that we can't do real science. We can't do what we signed on for, what we studied. And I think that happened at the university level. Then it happened at the FDA, at the CDC, where these companies had these public-private partnerships, and they took over the government, the universities, the media, and they just poisoned the American public for 30 years.
Yeah.
And I think now what we're seeing is that that's being reversed. And it's an incredible period of possibility and of hope. And I think it's hard for a lot of people who have sort of Trump derangement syndrome to kind of focus on that. But it is real. It's actually happening. And everybody ought to get on board. They should set aside their differences and, really love their children, their own selves, their bodies more than they hate each other.
I'm of the belief that it's either Doge or MAHA that's going to become history's going to look back and say these were 1, 2. I don't know how you want to grade them. I probably shouldn't. I know how you would grade it, but they're going to. I think history's going to look back on these two movements as game changers in how we did government, and I'm here for it, Tony. What do you say?
I think this is an incredible moment because, if you don't have healthy children, you have no future. There's no future to a country that has unhealthy children carrying around pill boxes that used to be reserved for 80-year-olds or 90-year-olds. So I think that this is a turning point. It's an inflection point, and that this is something we're going to look back on, and we're going to say, laugh, but laugh with pride that we were able to fight back against this incredible corruption and protect our children and our families and our future.
I love it, Tony. Tony, I want to do a quick lightning round with you. If you had to have one word that defines the CDC today, what would it be?
Well, I think it's been just a cesspool of corruption, but now I think there are a lot of people kind of moving in. And if you look at the advisory council, the ACIP, I think that has a lot of very great people on it, like Dr. Robert Malone. So I think there's a lot of progress being made, but that it has been a cesspool of corruption that has lied to the American public.
Wow. I've had him on this show, too, Dr. Robert Malone. I mean, I love that guy to death. One reform that you believe could restore integrity overnight.
I think that, President Trump was great when he said, he's proud of warp speed, but he wants the American public to know that he got lied to just like we all got lied to. And he demanded radical transparency from big pharmaceutical companies. And I think we can never allow one of these companies to say, we're going to disclose our clinical trial data in 25 years or 50 years or 75 years. It has to be right now. We have to have radical access to information on the CDC website, on the FDA website, so that people can look and learn for themselves. And I think that will change a lot, that these companies cannot hide their data from the public and that people will make better decisions as a result.
Tony Lyons, the biggest lie told to the American people during the pandemic.
I think the biggest lie was that the people in charge had good information and that they were using science to protect the public. So, we know, as I said before, the vaccine didn't prevent you from getting COVID, from transmitting COVID. The clinical trials were not scientific. The cost benefit wasn't there, that, most people, maybe, 90% of the people who took the COVID vaccine should not have taken it. So, and there certainly should not have been any mandate for anybody. So those are serious lies, and they opened up the minds of millions of people. So it's a fascinating kind of period that it just got to a threshold.
Wow. The biggest liar was Dr. Anthony Fauci. Tony Lyons, director of MAHA Action, I want to thank you so much for coming on. I definitely want to keep you in rotation because what you provide over at MAHA Action is tools and information for people to never to be lied to again like we were for 3.5, 4 years. So thanks so much for coming on.
Yeah. Anytime.
All right. That was Tony Lyons, director of MAHA Action and president of Skyhorse Publishing. Here's what that conversation reminds me of, Paul. Science without integrity is politics with a lab coat. This fight is no longer about vaccines or viruses, Paul. It's about truth, accountability, and the right of a free people to ask questions without fear. The rebellion, it may look chaotic, but it may also be the spark that forces reform. Either way, the American people will have to decide who they trust more, the bureaucrats who failed them or the citizens who finally said enough. You're listening to Detroit's Morning Answers. Stay tuned, stay sharp, and never stop asking questions. We'll be right back.